It's my pleasure to present REDUCE-IT Renal. As you remember, REDUCE-IT is a randomized clinical trial who assign patients treated with statin between Icosapent Ethyl 4 grams per day and placebo with optimal medical treatment. Patients with elevated triglycerides were randomized between Icosapent Ethyl 4 grams per day and placebo control. As you know, there was impressive results concerning the primary combined endpoint with non-fatal stroke, non-fatal MI, cardiovascular mortality, unstable angina, and urgent revascularization. Combined secondary endpoints associated cardiovascular mortality, non-fatal stroke, non-fatal MI. As you know, there's some concern about the efficacy of the treatment in patients with chronic kidney disease. Therefore, there are pre-specified analyses according to the glomerular filtration rate. The results were published in Circulation. They are quite impressive. The safety is very good concerning Icosapent Ethyl. Concerning efficacy, the higher is the risk, the higher are the benefits. Indeed, patients with glomerular filtration rate reduced are more benefits with Icosapent Ethyl than patients with glomerular filtration rate no more above 16 milliliters per minute. Concerning safety, Icosapent Ethyl slightly increased the risk of atrial fibrillation and serious bleeding with no interaction according to glomerular filtration rate. In view of REDUCE renal results, who are the CKD patients eligible for Icosapent Ethyl 4 grams per day? First, patients with CKD and primary prevention with diabetes type 2 and one additional factor. Second, patients in ASCVD patients with high persistent triglyceride under statins. Remember that the higher is the risk, the higher are the benefits. Therefore, Icosapent Ethyl should be prescribed in high risk in primary prevention and in secondary prevention with persistent high triglyceride under statins. As Icosapent Ethyl is well tolerated, there's no contraindication in this prescription in CKD patients. In conclusion, Icosapent Ethyl is efficient with an excellent safety in patients with normal glomerular filtration rate, but also in patients with reduced glomerular filtration rate. Just remember that it was a randomized clinical trial with pre-specified analysis concerning glomerular filtration rates. I have no conflict of interest with Amarin or Icosapent Ethyl. I hope you enjoyed this presentation. Thanks.